Western societies are facing a healthcare crisis where they're having to deal with the burden of chronic wounds, which are classified as wounds that do not heal within 3 months. National health budgets are expected to rise annually as a natural consequence of an aging population and the diabetic and obesity epidemic. Complications to non-healing wounds are vast, and patients are at risk of severe pain, hospitalisation and amputations. Better diagnosis and wound management may prevent chronic wound formation. Therefore, a new tool to help identify changes in the wound healing process may prevent this from occurring. This is where wounded artificially made skin models like Labskin produced by Integument may really help assess the wound healing process and identify the molecular differences between normal and chronic wounds. Chronic wound models are made from wounding the skin with a sharp implement, and then bacteria is placed directly on top of the wound site. Infected samples are compared against non-infected samples to assess the molecular changes between the two wounds. These models are snap frozen at specific time points, cut very thinly, covered with a special matrix, and analysed by an analytical technique called matrix-assisted laser desorption ionization, coupled with mass spectrometry imaging, where a laser is fired directly on the sample, allowing proteins or lipids to desorb and enter the detector. It separates the molecules and produces a spectra at every point where the laser was fired. From the spectra, single molecules can be looked at, creating a coloured image based on its concentration across the sample, identifying which molecules are involved in the wound healing process. These molecules can then help assess people who have wounds to make sure they aren't developing a chronic wound, therefore reducing the national health budget burden across Western world countries and improving the patient's quality of life.